Good evening, everyone, and welcome to the New Teeth Now webinar. My name is Bianca, and I'm here tonight with Dr. Kirkpatrick. And tonight we're going to be talking all things dental implants. So welcome. We're so glad that you joined us. And we also would love to ask for you to ask us questions. So if you're on GoToWebinar, there should be a chat box in the lower right-hand corner of the screen that you can submit questions. If you don't see that chat box, there's a little arrow you can click to pull that up. And then on YouTube, if you're joining us through there, you can chat right in the comment section and we'll read those as well. So thank you for joining, and how are you doing tonight?
Yeah, I'm doing good, Bianca. Thank you for being here with us. Yeah, awesome. So we will get right into it so we won't waste a lot of your all's time, because I know it is a little commitment to be on here with us. And, you know, I'm sure there's some better things to do on a Tuesday night, but hopefully you get a lot of questions answered. And like Bianca said, definitely submit questions if you have any, and we'll try to answer those live on the air tonight. And if we do not get to them for some reason, or you just want to call the office tomorrow, definitely do that and we'll make sure that you get an answer to your question. So like Bianca said, we are going to talk a lot about implants tonight. And you know, we'll start with just kind of get to know me slide. So I'm originally from Kentucky. I did all of my school at the University of Kentucky. And then my surgery residency was done at the University of Florida in Jacksonville. And I am a board certified oral and maxillofacial surgeon, which is very important tip to take away from tonight, because that is one of the things that we think differentiates us, which we'll talk about later, from a lot of other places. But you really want someone who has been trained in the surgical field, have extensive training with the anatomy, and can get you the best result possible with implants. So dental implants, they are recognized by the American Dental Association as the best way to replace missing teeth, whether it's one tooth, a couple teeth, or what we're going to talk about tonight, a full set of teeth, replacing everything in the upper jaw, everything in the lower jaw. So for those of you that do not know what an implant is, it's the silver structure that you can see that's going into the yellow part on the picture, which is meant to represent bone. So the implant essentially looks like a screw that's threaded like a screw. It gets placed into the bone, and then the bone actually grows and attaches to the implant. And then that gives either us or your general dentist a foundation to build your teeth or your bridge on. So the way we do the upper jaw, when we're replacing everything on the upper jaw. So if you're missing everything, or you need to be missing everything because you have severe periodontal disease or a mouth full of decay, then what we do with this is we place 6 implants in the upper jaw. And that can be done at the same time that we do extractions if needed, or just if you have no teeth, we can put the implants in and put temporary teeth on that same day. And this shows a little picture of kind of what that would look like. You can kind of see a ghost image of what the implants look like going into the bone with the bridge screwed into those implants. So unlike a denture, it's not removable. You can see it's got very little bulkiness to it. So nothing like a denture. There's no wings that go underneath the cheeks or the lips, and nothing covers the palate, which is super important. The lower treated very similar to how we do the upper. So we place 4 to 6 implants on the lower jaw, and the teeth are then, you know, it's this horseshoe shaped bridge that's screwed into the implants on the lower jaw, and it's fixed. You treat them like natural teeth. You brush them every day, toothbrush and toothpaste, you know, and then every 6 months you do need to go get those professionally cleaned, just like we do with our natural teeth. So it's something, even though they're fake, it's a bridge on implants, and there's nothing, it's not your natural tooth structure, but you still need to go have those professionally cleaned. Anything that's in your mouth that you can't take out and like wash under a sink, you really need to get professionally cleaned, because we all have spit glands, which helps us digest food, keeps your mouth moist, and those also contribute to the formation of plaque and calculus when the spit mixes with our food and drinks that we all consume. So when that forms plaque or calculus, it'll build up on these bridges just like it does your natural teeth. And that's something that you can reduce the amount of how much accumulates by brushing and using a water pick, but you still need to get those professionally cleaned, because just with a toothbrush and toothpaste, you can't get everything off.
Right.
So tonight we're going to talk about a lot of different things with what we can accomplish with implants. But importantly, we're going to show you a lot of before and after pictures, because I think they do a really nice job at showing you kind of what we can accomplish with the implants. Instead of Bianca and I just kind of telling you how great they are, you'll actually get to see patients that have had this procedure done and what they look like when they came to see us before the implants and what they look like after the implants. And all of these patients that we're going to show are patients that I've personally treated, which is also important for you to know. They're not stock pictures that we picked up off of a website or book or some other office. They're patients that I've personally treated. So our first one, Bethany, very lovely young lady, and she came in with a different story of her own. Everybody's different and everyone has their struggles that they've been through, especially with their dental background. But she was essentially born with a dental condition that delayed and eliminated some of the development of a lot of her teeth. So she had dentures at a very, very young age and just kind of grew up. That's what she knew, how to take her dentures in and out. They needed to come out at night. She needed to brush them, under a sink. And the older she got, the more options she started looking at, and found us and hoped that there was an option to where she could get rid of her dentures and have an implant bridge. So she came to see us for a consult. We spent quite a bit of time talking to her about what we thought we could accomplish. And after looking at her and doing an exam and looking at her CT scan, we determined that she was a good candidate for the implants. And we were able to help her out with a huge transition in her life, going from something that's removable, very bulky, taking up a lot of space in her mouth, to something that's fixed in her mouth, implant bridges that she treats essentially like natural teeth. So it really was cool watching that transformation with Bethany. So I'm gonna let her tell her story. We have a video of Bethany.
I had looked into dental implants before, but I had had so much bone loss from having dentures that it just didn't look doable for me anymore. When I was 8, I got dentures, and it looked awful.
And the longer you have a denture, the more bone loss you have. And when you have a lot of bone loss in the back part of the upper jaw, you either have to go through extensive surgery with bone grafting, and you let that bone graft heal, or you can use zygomatic implants and kind of do everything in one day. We're able to put 4 across the front, and then the 2 zygomas in the upper jaw. And on the lower jaw, I typically do 4 implants for the entire bridge, but she had enough that we could squeeze in 6. It's a great feeling just knowing that in one day, make that big of a difference in a patient's life. All right, girl, we all want to see.
Okay. Wow.
They look good.
They look so great. I'd say there's definitely hope. If you think that you can't have dental implants, obviously you definitely can. Now, thanks to Dr. Kirkpatrick, I actually feel free to smile freely and I can eat whatever I want.
Okay, so you can see Bethany's before and after picture, and just what a huge difference.
She looks amazing.
I mean, she looked good before, but she just had to deal with something that was removable to give her teeth in her mouth. Right. Now she doesn't have to worry about that, and you can see there is a difference in her smile.
In the face structure too.
Oh, and the face structure, filling out, replacing missing volume, and it was incredible to be a part of her journey with her. So why do people do this New Teeth Now procedure? Number one, we always talk to patients about restoring your total body health. A lot of people deal with periodontal disease, decay, a lot of infection in the mouth, and that should be the number one goal when considering doing something like this. I mean, of course, you get the benefit of the appearance, the cosmetics, but more importantly, it's more from a functional standpoint that we look at doing this procedure. It gives you teeth that you can chew, foods, things that you would maybe not be able to if you have dentures that they move around when you're trying to eat something really hard or chewy. If you have a mouthful of decayed teeth or a lot of periodontal disease, a lot of times it can be painful to eat certain things or drink cold liquids or really hot liquids. So number one should be to restore just your overall total body health. And then definitely you can tell by looking at the pictures of just Bethany, you know, looking at her before and after, it will improve self-confidence, helps bring out a natural smile, gives you the ability to eat what you want, like we were talking about earlier. And when you come here, one of the things it does also separate us, besides being board certified oral surgeons, you are asleep during the entire procedure. So we have an anesthesia team and fully functional outpatient operating rooms. So you go completely asleep for this. There's huge benefits to that. Not only is it, in our opinion, the safest way to do this procedure, because we can totally protect your airway and not have to worry about, you know, are we using too much water? Are we not using enough water? Are we not being able to place the implants in certain positions because you're either awake or you're just sedated? When you're truly asleep, we have total control of where we can place these implants and get them in the most beneficial spot to make the most perfect bridge for your mouth, because everything is custom with these. So the closer we can get the implants to where they exactly need to be, the better for you in the end. And then the post-operative pain level should surprise you. It definitely surprises us, and it's pretty routine for us to hear that patients will come in and they're like, gosh, I just can't believe, like, I had a couple teeth removed 4 years ago, and I just remember it being awful for 5 or 6 days. You essentially took out the rest of my teeth, placed implants and new teeth that same day, and yeah, it was kind of sore for a few days, but it was nothing like having just a couple teeth removed. There's a lot of good reasons to that, or for that, and we know those, but we essentially close everything at the end. So your gums, anytime we make an incision, it's totally stitched closed, so there's no open bone, which can be very painful, and you've got teeth setting on to kind of protect the area that we just operated on, and that makes a big difference. So the oral body connection, your mouth is the gateway to a really awesome creation. You know, it's the first thing that, I love saying this, it's the first thing that encounters everything you need to survive.
Yes.
So breathing, the air comes basically through your, part of it comes through your air. Some goes through your nose or through your mouth, but some goes through your nose. And when you're breathing and you take a big breath in, if you've got a mouthful of bacteria-infested periodontal disease, some of that does get, you know, aspirated down into the lungs, and that can cause problems over time. Can increase your chance of developing COPD. If you have, you know, asthma, it can increase your chance of developing or make your asthma worse. And then you got to think about the food you eat that helps keep you alive. You're chewing your food that you're going to swallow into your stomach in a mouthful of bacteria. Yeah. So that's a huge benefit and a big reason to do this procedure. So periodontal disease, it's well known in the literature, and a lot of universities study the relationship between periodontal disease and the rest of the body, but essentially it's a low-grade chronic infection that your body's always fighting. So the longer it's fighting that, it can increase your chance to develop respiratory diseases, digestive diseases. I mean, it can affect women who are pregnant or becoming pregnant in the near future, increase your chance for diabetes, makes your diabetes a lot harder to control. That is something that we do hear from multiple patients, several times that I've heard where patients, type 1 diabetics, or even some type 2 diabetics, who they just have a really hard time getting a grasp on all the, you know, the ups and downs of their blood sugar levels. And when you're fighting an infection, it makes it a lot harder to do that. Right. So when you eliminate periodontal disease as one of those causes that can be affecting your diabetes, patients have told us over and over again, gosh, it just seems like it's a lot easier to keep my blood sugar tightly controlled. And that's I mean, that's a huge, that's a huge thing that if that can help you control your blood sugar in a more normal
just makes life
relationship.
Easy.
Oh yeah, but that's how significant periodontal disease can affect the rest of the body. So, and then you can read the others: increase your chance of heart attack, stroke, osteoporosis. But essentially, it's just your body's fighting this chronic infection. The longer it does that, it can reduce the effectiveness of your immune system overall, which can ultimately lead to shortening your life expectancy. And everybody's doing everything they can, working out, vitamins, probiotics, eating healthy, trying to increase your life expectancy. Mm-hmm. And then you could have one thing that can be treated to help, with that, instead of it shortening your life expectancy. So periodontal disease, what does it look like? Well, like the picture on the left. So you can see the actual gum tissue doesn't look bad. This is not I wouldn't call this a really severe case, but it's bad enough. And you can see the crowns of the teeth, you can see missing teeth, and you can see yellow colored material between the gum and the crowns of the teeth. And that yellow brownish color material, those are the roots of the teeth. So it's because bone loss from periodontal disease, the bone shrinks away, the gum follows and recedes, and then you've got exposed root surfaces. And those exposed root surfaces, like you can see there, they can be really sensitive. They erode really easy because they're not protected with the enamel, which covers the crowns of the teeth. And it just can make it really painful to eat certain foods, drink certain liquids. But overall, with this patient, it definitely can be treated. They had plenty of bone for implants. We took everything out, cleaned all the periodontal disease away, placed 6 implants that you can see there on the picture on the right. And this picture, by the way, is immediately after surgery. So the patient's still asleep. I wanted to get this picture to show the difference between just what a few hours can accomplish. A mouthful of periodontal disease to essentially infection-free mouth with implants that later that afternoon, they're going to have teeth screwed into those implants. Here you can see the little connectors after the incisions have healed. And this picture is about 3 weeks after the surgery. But you can see the difference is with the picture on the right, there's no infection. Healthy gum tissue, healthy bone level around all the implants. And here is his before and after picture. So it's amazing what just a few hours in the OR with some prep time to make temporary teeth. And those are just his temporary teeth. So these are the teeth that we put on the same day that we do the procedure. And with this procedure, we'll get to in a little bit, but you essentially get 2 sets of teeth. You get a temporary set that we put on the same day. You wear those anywhere from around 6 months while your implants are completely, or your bone is fusing with the implants and the gum is healing around the implants, and then we start making your final teeth. There's some really good reasons that we wait that long, where other places may not, and they advocate for trying to put your final teeth on either the next day or within a couple weeks. Mm-hmm. Dr. Richards and I, we feel like that's not the best way to do it for a lot of reasons. A, your implants have not healed with your body yet, so we really want that phase to happen. But B, more importantly, we know everyone that has this procedure, as your bone and gums heal, your gums are going to shrink. They're going to shrink, they're going to become healthy, and they tighten up around all those connectors that are connecting the teeth with the implants. That shrinkage takes place and happens over the first 3 to 4 months of after the procedure. So if we put your final teeth on and your gums shrink and you develop that space there, you're going to hate that space. So if you've already got your final teeth on, that's the way it is. You're going to be permanently with that space unless you pay someone else to make a new set of final teeth. So what we do is we give you a really nice set of temporary teeth that you wear for 6 months while your bone is fusing to the implants and your gums are shrinking. Once that process takes place, we know your bone is fused with the implants, we know your implants are now a part of you, and your gums have stabilized to their new happy, healthy position. Then our restorative team in the lab builds your dream teeth on your new gum level, and that doesn't change once that process has taken place. That's how you get the best fit, hands down, with these teeth. And that's what we do here, because that's what we believe, that you can get your best set of teeth that you'll be happier with. So if you want to be truly healthy, you must think about your mouth and restore your oral health. So who's a candidate for this procedure? Well, if you have no teeth or you're unhappy with your dentures, definitely you're a candidate. If you have a mouthful of bad teeth, if you have severe periodontal disease, or if you've ever been told that you do not have enough bone for implants, I would highly encourage you to call, schedule a consult with us, come in, just let me do an exam. We obtain a CT scan, which shows me a three-dimensional kind of view of what your bone looks like underneath everything, so we really know exactly what's there and how we can accomplish placement of the implants. And we have a lot of different ways here and techniques that a lot of other places do not have. One is the zygomatic implant, and that has been just a total game changer for patients that do not have a lot of bone in the upper jaw, whether it's in the back part of the upper jaw, the front part of the upper jaw. We can bypass those areas, place zygomatic implants, which they're named the zygomatic implant because of your zygoma, which is your cheekbone. So these implants bypass the upper jaw. They're anchored into your cheekbone, and that gives us a really sturdy foundation to build your teeth on without bone grafting and still able to do the procedure in one day. So it's been a huge benefit for patients to have the zygomatic implant in our toolbox of things that we can use to help patients without a lot of bone. So this patient, another one of my favorite patients, which all my patients are my favorite patients, but you know, he just very outgoing personality. He came in with mouthful of bad teeth, mouthful of periodontal disease, lots of infection in his mouth. And you know, he just wanted to know if he is a candidate for implants. He didn't think he had enough bone, but he was also struggling with, should I do a lot of work that's needed on my house with renovations, or should I invest time and money and effort in my teeth and my oral health? So his family talked him into coming in for a consult. We had a really good discussion, and he had plenty of bone to do the implants. So we set him up for the procedure, and when you see his after picture, you will know that he made the right decision with this before and after. A huge difference in his smile, huge difference in just his oral health, because there's zero infection. He has a mouth full of implants instead of a mouthful of infection, with secured bridges on these implants that he can kind of eat pretty much anything he wants and not have to worry about when the next time he's going to need an antibiotic for some infection that pops up. People who have dentures are definitely a candidate for this procedure. And like you can see with this lady, you know, her teeth on the before picture on the left, they don't look that bad, but they're removable. They're plastic, they're acrylic, they're a denture. So she was tired of having something that, you know, she had to take in and out of her mouth every night, set on a nightstand beside of her bed, and clean, or food or something gets stuck underneath it when she's out at a restaurant with her family. She just was tired of having the roof of her mouth covered, everything with a denture. She couldn't wait to get rid of the denture if she was a candidate for implants. And of course she was. The way we can bypass and place implants in certain positions, she had plenty of bone for implants, and you can see her after picture, and those are implant secured bridges. Another lady came in with a denture. You can see this is a picture of retracted lips, so we can see her upper jaw, significant bone loss, but you can see upper gums. She tried to wear a denture, it didn't fit very well, wouldn't stay in place. She did have a couple implants on the lower that had been there for years that she used to snap on a lower denture, which is way better than just a conventional regular lower denture. It did have a lot more stability, but these implants started to fail. They started to get some infection around them because of the repeated snapping on, snapping off, snapping on, snapping off of the implant over denture. And over time, just wear and tear on the implants, she started getting some bone loss around the implants, which is not very common, but it can happen when you're repeatedly doing something with an individual implant. But when you have teeth that are stabilized and connected all the way around the arch on implants, so they're not removable, you're not really messing around with them, you're just they're secured in your jaw, implant or bridge screwed onto the teeth, so you're not constantly taking them off, putting them back on, snapping them on, then your implants have a really, really high success rate. So we took those 2 implants out, put implants in the upper and lower jaws, and there she is with screwed in bridges, fixed bridges in her mouth that she brushes, toothbrush, toothpaste, uses a water pick to kind of clean underneath them, and goes to get cleanings every 6 months. So zygomatic implants, we talked about those a few minutes ago, but essentially they, like I was saying, are made for people who do not have a lot of bone in the upper jaw. And with this young lady, and we get patients that come in from all over the place to come in and have this procedure done.
Yes.
Because unfortunately, there's not a lot of people that are either, they're just not trained to put in the zygomatic implants, or they haven't done very many, so they're not comfortable doing the zygomatic implants. And this is something that we do every day. We're very blessed and fortunate to do these a lot. I would say 75 to 80% of all these procedures I do, and I do one of these every day, Monday through Friday, but 75% or 80% or maybe even more,
quite a bit, yeah,
need zygomatic implants.
Yeah.
So, it's just something that we don't really take for granted, but it's just routine for us. We do a lot of them, which people eventually find out about. And, from our website, some of the marketing material, word of mouth, from friends or family that's had the procedure done. And we've treated someone from all 50 states,
yes,
which is kind of cool.
It's awesome, yeah.
To know that. And mainly it's been because the patients needed zygomatic implants, like this young lady. So she came in from the northeastern United States, and she had been to multiple dentists, multiple oral surgeons, and she'd been told that she really didn't have enough bone for implants, but she had a 1-piece horseshoe-shaped bridge that was on her remaining teeth. The whole thing was failing. You could essentially move it in and out with your fingers, and she did not want to even entertain the idea of going into a denture. So somehow she found us on the internet. She called, talked to one of our implant coordinators, got a lot of information during that phone call, decided to schedule a consult. She came down, and after seeing her for the consult and doing the CT scan, she did need a little help in the back part of her upper jaw from zygomatic implants, but she had plenty of bone for implants. Very straightforward case, and this is what we're able to do for her. So you can see her after picture, and I also like to put that picture with the x-ray showing traditional implants in the front and the middle part of the upper jaw, and then the zygomatic implants are those longer implants angled toward the back. And they're a little longer because they got to reach out and secure into your cheekbone, into the lower part of the cheekbone, and that's what they look like. And they just gave us the ability to be able to give her a fixed set of bridges on those implants in one day without bone grafting. So it's a pretty cool procedure to be able to help patients with. This video that's playing is showing how zygomatic implants kind of go in from a 3-dimensional standpoint. So you can see the traditional implants in the front and the middle part of the arch, and then the zygomatic implants in the back, angled toward the back to give us the ability to put 6 implants in, secure the bridges, and these things are rock solid when they are put in correctly. So people who are missing a lot of bone or have very, very little bone in the upper jaw, we can do a procedure that we call the quad zygomatic implant case, where this is made for people who have essentially no bone anywhere in the upper jaw. Mm-hmm. So we just totally bypass, it still goes through the upper jaw, and it's anchored into the part of the upper jaw that would connect to the teeth. But most of the implants are anchored into the lower part of the cheekbone. But to be able to do this for patients, without this in the past, either you would need significant bone grafting, or you really just weren't a candidate for implants, and you had to live with a very bad fitting denture. So now with the zygomatic implants and being able to do the quad zygomatic implant case like this x-ray is showing, that gives us the ability to treat patients who otherwise would be at the end of the road and would not be able to have implants placed. So one thing about implants that we do kind of get asked this a lot, and it always surprises me, but so they never will need a root canal because they're fake. You know, they're not alive. There's not a nerve or blood vessels that go into the implants. So they will not need a root canal. They're never going to decay. They're very easy to maintain. You just brush them like you would your natural teeth. Toothbrush, toothpaste, and we highly recommend a water pick because you can't floss because they're all connected. So you can't floss in between the teeth, but between your gums and the bridge, you use a water pick once a day. Usually I'd recommend doing that at night, kind of like the last thing you do before you go to bed. Flush out the daily collection if there's anything there. And then your gums have, you know, every how many hours you sleep at night to kind of recover and heal. Get up and start your day the next day. So key differentiators between our New Teeth Now procedure and a lot of other clinics, I think these three things you really need to remember if you're thinking about having this procedure done, or you think you're a candidate for implants, or you're thinking about going, you know, for a consult somewhere, or you're coming here, or you've been here and you're going somewhere else. I would have these three things kind of either in your phone, in the note section, written down on a Post-it note, somewhere where you can think about to compare when you're thinking about going somewhere else, or if you've been somewhere else. Because these three things, if you could put those back up, board certified oral surgeons, I can't stress how important that is for who's treating you. To have a board certified oral surgeon means that we've all had the appropriate surgical training, we know the anatomy, very comfortable with whatever would need to be done with your implants, but more importantly, can take care of the complications. And that's something that I feel like that really gets overlooked because there's no laws or rules on who can put in implants. And that's fine. You know, general dentists can place implants. They're trained to do so. Periodontists, some endodontists can place implants. But to do a full arch replacement, you really want someone who A, does a lot of them, B, who is extremely trained in them, but C, that's where you would go and they would take care of you if you had a problem. I can't tell you how many patients that we've seen where someone else has done the procedure, they've had a full arch implant procedure done, and now they're having a problem. And that person that treated them initially kind of throw their hands up like, gosh, I don't even know what to do here. You need to go see Dr. Kirkpatrick or Dr. Richards, or, you know, I need to get you to an oral surgeon. That should tell you the oral surgeon should have been treating you to begin with.
Exactly.
On these. It's easy for us to think about that, but it's not when patients kind of get bombarded with a lot of different marketing materials, whether it's internet, TV, radio. You really need to think about that when you're considering having a procedure like this done. So zygomatic implants, for people who don't have a lot of bone, there's a really good option with the zygomatic implants. Instead of having bone grafting, waiting on the bone graft to heal for 6 or 7 months, and then coming back, and if enough bone took, doing your implants. If enough bone didn't take for the implants, then you're looking at another bone graft and waiting another 6 or 7 months. With the zygomas, we don't have to do that. There's a way better option to place the implants. And in my personal opinion, if I were ever going to have this done and I didn't have enough bone for implants, hands down, I want the zygomas, because when we can place implants into bone the patient has grown and developed with, I mean, Bianca, there's not a better option.
No,
You know,
that's
nothing,
why we've had people from orthopedics.
yes, and because nothing that I can graft you with can heal as well as bone that the patient has grown and developed on their own.
Right.
Bone grafts work really well, but the zygomas are a better option.
And
So-
less time.
And less
Very
time. And
convenient.
you can still do it in one day.
Yeah.
That's a no-brainer.
Right.
And then the general anesthesia, that's something that we see day in and day out. Talked to a couple of patients about it today. One patient had been to 3 or 4 different offices for opinions, and no one offered general anesthesia. And that, to me, you know, is just something that I was talking to the patient about. You really need to think about that, because A, if you're doing it under local, I mean, God bless the person that's the surgeon that's treating you or whoever's trying to put in the implants, and poor, pitiful you as the patient, because I cannot imagine setting through this procedure awake for a couple reasons. A, I know you're going to feel something. You can numb everything and make it where there's not a lot of pain, but you cannot take away the pressure. And if the patient's not feeling pressure and they're awake, undergoing this procedure, then the implants are not in the most ideal position. Because to get them there, you really need to try to go back as far as you can to support the back teeth, which are your chewing teeth. And if you can't retract the cheeks back because you think the patient's hurting because you're retracting or they feel some pressure, then you'll compensate. Move the implant a little toward the front. Now it's not in the best position because you're trying to do this awake or on a sedated patient. And then if you're sedated, now you got to really worry about your airways not protected. So you're worrying about an assistant suctioning a lot of saline or what, you know, the irrigation, and that can end up in a disaster because you don't use as much irrigation as you need to keep the bone and the implants cool when you're doing the procedure, or use too much irrigation or the appropriate amount of irrigation and a little of it trickles down in the windpipe.
Right.
Then you're in trouble.
Right.
So the safest way to do this, if you're going to do this procedure, you do it in one day under one roof with an oral surgeon. If you need zygomatic implants, choose that option, and under general anesthesia where we control and protect and secure your airway with our anesthesia team.
We did have a couple questions come in if you
Yeah,
want to
now's
answer
a great
those.
time
Yeah.
to answer some questions.
So how do you go about fixing an implant that isn't osseointegrating properly after the procedure?
Well, that would be a problem with that implant. And that's something that, you know, if that happened and a patient had an implant that was, because we would consider that a failing implant. And if we had that and the implant was failing, then we would remove the implant, look at what's left around the area. And most of the time, because I've had that happen. I mean, we've done, you know, when you do this many implants, you will see, a few implant failures. Thankfully, with this procedure, these implants for these full arch bridges are super successful because they're for a lot of good reasons. But A, we eliminate any infection that's in the mouth, and there are no natural teeth around these because we're taking everything out. So we're kind of starting with a clean slate. So it's kind of rare for an implant to get infected or not integrate with the bone after this procedure. But if it does, we remove the implant if it needs to be removed and clean out the area. Most of the time we replace the implant that same day with a new implant, slightly different size to get it, you know, to adhere to the bone. And if that happened, then it may prolong getting your final teeth for a month or two. Okay. But I mean, that's a great question. And I always talk about, you know, all the bad things that can happen with these. And is it possible for an implant to fail? Yes. Is it common? It's extremely rare. So it's not common at all. But we've had that on, I mean, I've had that with my personal implants. I've had that with patients that have had implants placed somewhere else and they've had implants fail. almost always we can try to pinpoint what happened with that implant, and almost always it's because the patient was eating something too hard before the implants or before the bone has fused with the implants. And that is one of the main reasons that when you're here for the consult, and every time I see you when you're here for follow-up appointments, I remind you to stay on a soft diet while you're in your temporary teeth. The main reason for that is, and the number one cause for implant failure, is to overeat on implants that bone has not fused with. You got to treat these like a broken bone. Yes, you get the ability, we put teeth on, screwed into your implants the same day. It's better for the implants for healing with a little bit of function on them, but too much function, too hard a force when chewing can cause the implants to not integrate. But that's a good question. But I will say, before you go to the next question, with implant failures, even ones that I've had, I have never had a patient, since I've been here in Lakeland doing this procedure, since 2007, I've never had a patient lose and had to have their implants or teeth removed because of implant failures. So that should tell you something.
Yeah. That's great. This question is very technical. So what steps are made to minimize the risk of maxillary sinusitis?
Sinusitis.
Okay. And also to avoid infraorbital nerve paresthesia. I don't know if I said all that right.
Okay. Great question. Someone out there asking this question knows they've either been around the block with these researching this, or they've got a little bit of background in the dental world. So any implant procedure, even any tooth extraction procedure in the upper jaw, especially closer to the back, everything is, it's a tight space. So everything is intimately connected, including teeth roots. Some teeth, their roots go all the way into the sinus. So that's one thing that we look at on the CT scan to kind of be prepared for that if we think it's going to happen. Or we see a lot of patients who have chronic sinusitis from their teeth, from bad teeth, from periodontal disease, because infections usually take the path of least resistance. So if your tooth roots are kind of going through the floor of your sinus and that tooth is infected, that infection is going to go straight in and fill your sinus. With implant procedures, usually removing the infected teeth, that sinusitis resolves. Okay. But with our implant procedure, is there a risk of developing chronic sinusitis? Of course. If you read all the consent form and we talk about all the bad things, there's a risk for essentially anything. Is it common? No, it's not common at all. There's a lot of things that we do and spend a lot of time when we're doing the procedure to make sure that we are outside of the functional sinus. So your sinus is a big bony cavity in your upper jaw, but it's lined with a membrane. So we make sure that implant is outside of the membrane if we're putting in zygomatic implants. If we're just putting in traditional implants, we keep the entire thing out of the sinus. If we're doing zygomatic implants, they're in your bone, but outside of the membrane. That is what makes your sinus work and function. Since we've been doing that, which is kind of our way of placing the zygomatic implants, especially after doing, once you do thousands of these, you kind of, from experience, you know what works really well and how we've made them better over the years. And that's one thing that we really watch and pay attention when we're in that position, placing those zygomatic implants. We want to stay out of the sinus. That is almost eliminated ever seeing that, which has been a big game changer. And that's been over the last probably 3 to 4 years, right before COVID came around. We were, doing it that way, which is a little different than most of the people who place the zygomatic implants. We try to do everything we can to get them in the most accurate position where your teeth would be, and that helps keep them out of the sinus. Now, the infraorbital paresthesia, fancy medical term for talking about a little numbness to the infraorbital nerve, which I was talking about, that comes out and gives you, innervates and gives you feeling, to the side of the skin on the side of the nose, cheek, upper lip, upper gum area. So that we see that nerve, we find the nerve on purpose to make sure we visualize it. We know where the nerve is. So we're totally staying away from that surgically. We know we're not drilling around the nerve. We're not placing your implant that's around or touching the nerve. We're close to it, but we are safely away from it. And that is what can cause that temporary or transient infraorbital paresthesia. So we do everything we can to try to limit that. Most of our patients, and I give you a long-acting numbing medicine, so definitely when you wake up, you're completely numb, everything's numb. You have paresthesia pretty much from your eye sockets down to the lower border of your mandible. But over the next few days, as that numbness, the numbing medicine wears off, almost everyone gets their full feeling back. Occasionally, like we talked about earlier, we have a patient that will kind of have some lingering post-op numbness, but that, like I said earlier, I've never had that be permanent. So it hasn't really been an issue. So I hope that helps and answers the question.
So I think we're good for questions for now.
Okay. Well, keep them coming. If you have any questions, keep sending them in. So the all under one roof, that's another really important thing that we feel like that kind of separates us from a lot of other people. Like everything is here, from your consult to your impressions with our restorative team, your surgery with me. We have our operating room here in this building. The lab is in this building, so your teeth are actually physically made here in our office, part of our New Teeth Now procedure, as well as the final teeth. So pretty much everything is made within our company here, which is really important, and it's a big benefit to you as the patient. And you may not realize this, and we're going, do we have Dr. Dibbs' video?
We do.
Maybe, okay.
Yeah.
So his video, Dr. Dibbs is one of our restorative doctors here, and he kind of talks about, from his perspective, from the restorative dental perspective, what it means to not only have the surgeon in the same building as him, the lab in the same building as him, and kind of everything here, so we can all talk as needed, bounce ideas, look at the same patient all at one time when they're here, getting their final teeth. If they have a question about, hey, can you guys do this? Well, we'll all talk about it. And the lab technician that would be making your teeth can come and physically look at you. So they not only see your facial shape, your skin tone, the shape of your mouth, your lips, when you smile, how far your lip and cheeks go up and move around the temporary teeth. And that's super important when it comes or time to make your final bridge, or when you're thinking about any changes that you want to make going from your temporary to your final, which is another benefit of waiting that 6 months. You kind of get to test drive these temporary teeth. So you figure out things you like about them, things you don't like about them, things you love about them, things you hate about them. And then you can talk about that with the restorative team in the lab, and they can talk to you about how they can change that on the final. So you're not stuck with the same set of teeth. So the all in one day, now it's not misleading, but I don't want you to get the wrong impression. You have to come for the consult. So your consult and surgery is obviously not going to be in the same day. And I had a patient try to call me out on that one day, and I just kind of, okay, I get it. It's not all in one day. You've got the consult. You've got to come in to at least meet me. I introduce myself to you, you introduce yourself to me, tell me what your expectations are, and then we do an exam, your CT, figure out how we're going to approach this and attack the situation to get your implants in the best position that they can be in. But we've got to have time to make your temporary teeth that we're going to put in that same day that we do the procedure. And then most everyone, we try to do this with our anesthesia team in the safest manner possible. So just like it would be if you had outpatient surgery anywhere else. For another reason, you're going in to have your appendix out. They're probably going to want medical clearance, or at least basic blood work and an EKG. That's how we can make this the safest way possible. And that's how I feel that here you get the best care that you can get, not just from putting your implants in. We talked about a lot of people can put implants in, but we want to make sure that it's done in a safe manner and it's done correct the first time, where we're not needing to redo or go back to surgery for some reason. So having everything in one day, the surgical procedure is done in just one day. The temporary teeth are placed in one day. They're acrylic. Those are what you wear for the 6 months while your implants are fusing to the bone and your gums are shrinking. And then your final teeth, which is another very important point, they're made out of zirconia. If you're going to have this procedure done, zirconia is by far the best material for cosmetics and strength, and as far as like being considered a typical lifetime procedure, zirconia is the best material that we know of to be able to do this, and it lasts with little wear and tear over the years. So the consultation, when you come in for this procedure, we get a CAT scan, which is called an iCat, and then we go over that with you. So you're looking at your CAT scan with me, you're seeing where your good bone is, where your bad bone is, how I would approach that. If you need the zygomatic implants, I draw on your CT scan and show you where your implants would go. So you essentially go over the scan with me, and when we're doing that, I'm basically developing your treatment plan, but I know from that treatment plan exactly what I would need to do to you, where your implants would go, and about how big the implants or what size the implants would be. So our implant coordinators, Allie, Shauna, and Mara, all three extremely knowledgeable about this procedure. And they really make it easy for me when I come in because they get to you first. You probably would talk to one of them on the phone before you come in. Then you're going to be scheduled for an implant consult. One of those three will come out to get you, bring you back, go over the entire procedure with you. Then I come in and spend as much time as I need to with you to make sure you're comfortable with the information that you want to get when you're here for the consult. We go over the CT scan, but a lot of times, you know, they're so good at what they do that by the time I get in the room, I'll start talking and they just kind of look at Shauna or Mara or Allie, and they kind of go smile at them. And then they look back at me and I'm like, they've already talked about this? And they're like, yeah, Shauna already went over that. Or, oh, Mara already showed me like where the nerve comes out of the lower jaw. Or Allie's talked about the zygomatic implants. So you get a lot of information here at the consult. It's not a quick in and out. If you're looking for that, you need to probably look at a different clinic because we really want you to understand what you're getting into and how you can get the best possible procedure at the end of the day. So the coordinators, very, very well qualified and good at what they do. Our restorative team, Dr. Nafala, Dr. Dibbs, Dr. Sorrento, just like the coordinators, these guys have done thousands of these procedures where it's routine with them, and they've learned by doing so many of these what really works well for patients and how to get the best result from a main point, functional standpoint, but also a cosmetic standpoint. And then now I think we're going to have Dr. Dibbs go over his, oh, hang on, I've started that too soon. His perspective of how important it is to have the lab and everything kind of here under one roof.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
So, I've showed you the implant coordinators, the restorative team. Here is my surgical team. So all three of these young ladies, they've been with me for years, and it's very nice having them and to have them to know as much as they know about the procedure and to have the training that they have, because essentially, and I would never let them know this, but they really make life easier on a day-to-day basis, because they pretty much know what I'm going to do next. So if they're watching me and they're paying attention, which they do, then they already have, they know that I'm probably going to want this instrument next. So they've already got it kind of laid on the corner of the Mayo stand, ready for me to grab. Or they'll say, hey, do you want this next? I'm like, yeah, that's where we're at. So they're very well trained, and you get to really know them, because when you come here as a patient, you not only, definitely I'll be doing your surgery if you see me for the consult and you're seeing me as a patient. But you're not kind of bounced around. You're not going to see me for the surgery, someone else for your post-op appointments, someone else for, you'll see me and you'll see the same restorative dentist that helps make your temporary teeth will be making your final teeth. And you'll get to know Amanda, Corey, and Monica very well, because one of those three girls are going to be, or all three of them will be kind of around when you're here every time you come in for any of your post-op appointments. And if you called with a question, it's going to be one of those three that you're going to be talking to. So you're not talking to a call center, in some other country. You're calling and you're speaking with one of my team members that you probably already met when you had your procedure. And that goes a long way, because that gives it that small town office feel where it really is, it's not a big corporate world where you're going here for the surgery, you're seeing someone else, you never see the same person twice. Like, we really do get to know you, whether you like that or not. You're going to be, it's a really good thing, because then we can kind of really bring out what your expectations are, what you're looking for in your final teeth, what's going on, are you having pain somewhere, and we can address that and make sure everything's taken care of. And then you said there was one more question.
We did. So why is your procedure better than the G4 process?
Better than so I would address that question in terms of just comparing us not to G4, because I'm sure there's a lot of things that they do that work really well in their hands, but I would do that comparing us to everyone else, not just one particular place. There's a lot of different places that are doing full arch treatments, but the three things, those three big things that I talked about, those are what makes us different. Yeah. Those are what makes us better. That's just the way that we feel about the entire procedure. Is if you can have a board certified oral and maxillofacial surgery doing the procedure, that's one big difference. If you can be totally under general anesthesia, that's a second big difference. If you've got the ability to bypass bone that a patient, areas of bone where a patient doesn't have enough of it to place implants, and you can do the zygomatic implants, that's a big difference. And if you're the one treating your own complications every time, there's nowhere else. Like, we don't send our patients out because there's nowhere else that we would send you.
You're like the highest up for that.
We would send you to another oral surgeon, or they'd be looking at like, well, what would I do that you guys couldn't do?
Right.
You need to go back and see Kirkpatrick. I mean, it's just, you would be here with me and I would take care of you. We would take care of anything that could or would happen, like in the future with these implants. That's what separates us. That's a great question. So, anesthesia, we have a huge anesthesia team they're just incredible. They're very nitpicky, by the way, so they keep us on our toes, and they make sure that we're doing everything we can before you get here for surgery. So they've already been through extensively with your medical history, any history and physical from your primary care doctor, any of your medical specialists. They've reviewed your EKG, your blood work, any other material that would make a difference on how they would treat you during the general anesthesia. So we love having that part of our team here in-house, and it's just another thing to make us as good as we can be doing this. And then talking about our team, this is our picture of our entire team. And it takes everyone here to make the world go around in our New Teeth Now world, and which helps us deliver the best product and treat our patients in the safest manner. Do we have a video with Juan?
One last video.
Awesome, because I like this video a lot. Okay, so Juan is another one of my favorite patients. So came in from out of state. He had been to a lot of different providers, and he found us and felt more comfortable with what we said and did during the consult, and he chose to come here for treatment. And essentially he's going to kind of walk through and describe his story of what he experienced here and how it affected him.
I am different. I was born different. My adult teeth weren't growing in. And when I went to the dentist said that it was partial endodontia. You become extremely self-conscious. You're always looking down, looking away. You can't hold a conversation more than maybe 2 minutes before somebody looks you in the mouth, and it's always that stare. And they can't help it, it hurts. It's very hurtful. I'm 35 years of age and waiting my entire life to find a procedure. I finally found it, and it gave me the opportunity to change my life.
Oh boy.
See that?
Oh my goodness.
I thought it would be good, but this is phenomenal. The staff, you feel like family. Everyone here knows you on a first name basis. This is more than I could have ever imagined. Now, it's the confidence of speaking to someone and having conversations, and not having to look around to see if someone's staring at me, and just looking in someone's eyes and seeing them look you in your eyes is an unreal feeling. On my airplane ride here yesterday, I had a long conversation with an individual that was sitting right next to me who also was from Chicago. Then the lady in the aisle joined in on the conversation. I realized the entire time that I was looking at them both. They were looking me in my eyes, and we were having a whole conversation for about an hour, and I would have never done that in the past. One of the ladies said, "You have such a beautiful smile." To me, it's a whole new world. I had a really good feeling that everything was going to turn out in my favor, and it did. I know every day I'm going to smile as big as I can for no reason. because of New Teeth Now.
You heard Juan's story, great guy. And you know, he got a really, really nice result, as you can see with his before and after picture, and just extremely happy. And it's really, really fun to be a part of that with him. So just to review and kind of wrap this up, thank you guys for hanging in there with us tonight. Hopefully all your questions were answered, or we gave you a lot of information. But essentially, like our New Teeth Now procedure or process, we've extensively talked about this. You can read it on the screen, and I'm gonna let Bianca kind of take it from here and just talk about how you can learn more information and how you can get in touch with us.
So we have some fantastic resources, which I know a bunch of you are already on YouTube. So, you know, if you want to keep scrolling on YouTube after this and just watching more webinars, watching more patient testimonials, we have so many good videos on there. And then if you're looking, if you're interested in just seeing a lot more before and afters, go to our Facebook or Instagram pages. We have tons and tons of before and after pictures, so you can look at, you know, the differences in the teeth and teeth shape, size, color, all those things that you could eventually customize if you came to us. So definitely check those out. And I also encourage you, you know, if you have more questions, go to our website, message us on our Pure Chat messaging service. It's right on our website. You can type in, and you can also call us. So we'd love to hear from you. Again, if you have any other questions, if you'd like to schedule that consult, we're so excited to see you. We hope everyone has a wonderful evening, and we will see you next month.